Hello, my name is Kyle Kish. I am an occupational therapist by trade, currently a director of sales with Found. Couple questions that were kind of brought up that would help kind of summarize the utilization of notation and AI amongst therapists. Question one, what documentation pain have you personally experienced as a therapist? That could go on, but in the acute care setting, it could be anywhere from insurance denial, so not having appropriate documentation to support someone's discharge disposition, timing, so whether that's clinician-based, facility-based, clinician-based, or insurance-based, so whether the insurance company demands a note in to be submitted within a certain time threshold, sometimes by 10 a.m., sometimes by 1 p.m., or you have within 24 hours to complete your documentation per clinic guidelines. So notation would definitely help out with that because you're essentially getting the documentation done real time in the moment. Question two, what do most people outside of the profession not understand about therapy documentation? Could be everything I previously listed. Also, the fact that we have to truly highlight progress or regression with patients to kind of just really pinpoint how they're responding to our therapeutic approaches. As well as just making sure that our verbiage is appropriate for the insurance companies, as well as other clinicians and interdisciplinary professions to understand. Question three, how do you think notation can support clinicians without replacing clinical judgment? Notation has a lot of services provided within the system. Not only, as I mentioned before, having documentation pretty much completed while you're in the visit or right at the end of the visit, but also it offers you various kind of cues, as well as allowing the clinician to read so that way they can understand and verify that what they are telling or reading back from the patient is appropriate and kind of addresses all the needs that need to be documented. Question four, what would you say to a therapist who is skeptical about AI documentation? Honestly, I've been kind of skeptical about it, just seeing all these different memes and everything that pops up about AI. Just try it. That's what I've done with notation. Go in there, pros, cons afterwards, and then compare to the other systems.